All right, well, maybe we should go ahead and get started as people kind of join in over the next few minutes. Welcome, everybody. My name's Leigh O'Banion. I'm a vascular surgeon at UCSF Fresno. And I'd like to really welcome everybody for the first inaugural meeting of the Vascular Surgery Interest Group as part of the Western Vascular Society. We've got some really exciting panelists here today to discuss with everyone why they chose vascular surgery and the path that they took to get there. And as well as we have a couple of guests who are chairman, program directors, head of the IRB. So you'll get to hear from a lot of different people, a lot of different perspectives on their vascular careers and pathways. So we're going to get started. Heather, I think I can take control of your screen possibly, or you can just go to the next slide. That's fine. So first of all, I wanted to poll the audience. So if everybody that is attending today, I think Heather has made this into a poll, I believe. And so if everyone can answer, we just wanted to get an idea of, how do you plan on becoming a vascular surgeon? We're going to assume that you've decided to enter this awesome field. And so if you can get us an idea, if you know, if not, there's an option for that. So just let us know, how do you want to become a vascular surgeon? So we'll give everybody a couple minutes to vote. And don't worry if you don't want to know, if you don't know yet, we'll give you hopefully a lot of information tonight that'll help you decide. Heather, if you can see kind of when most people have voted, you can go ahead and close it out and we can see the answers. I can't see. All right. So about half of you guys are interested in going straight into residency, which is awesome. Definitely an option that a lot of us didn't have when we were applying. So we'll definitely get a perspective on that. And then it's great. About a quarter of you guys have no clue. So hopefully we can give you some insight, which is awesome. You don't have to know. And that's why we're here. So, so let's go on to the next slide. All right, so I'm really excited to introduce our current president of the Western Vascular Society, Dr. Michael Conte, my former attending. And so he's going to be here today just to give us a little welcome. He's the professor and chief of the Division of Vascular at UCSF. And the chair of vascular, as well as the director of the Vascular Surgery Integrated Residency, which just started, I think, about a year ago. So thanks for joining us, Dr. Conte. We really appreciate you being here.
Thanks, Leanne, and welcome to everyone. We're really excited to be able to host this event from the Western Vascular Society, and I really want to thank Dr. Humphries and her committee members and everyone who's on the panel today for making the time to do this. I think, for the students on the call, if you want to get a quick look at the future of our specialty and why it's such a great group of people, you can just look at this group today and you'll hear from them and see their excitement for our field. I always think it's important when I talk to students to tell a little bit about how I got to where I am in my background, because it's not that long ago, although it seems like it's ancient. I was a biomedical engineer undergrad before I decided to go to med school, so I was always interested a little bit in biomechanics and fluids and cardiovascular physiology. I thought I was going to be a cardiac surgeon for a while. But then I took 2 years out to do research, and I did my research in vascular biology, and that combined with something that I appreciated during my general surgery residency, which was I really enjoyed the diversity of anatomy being all over the body, really sort of clinched it for me to become a vascular surgeon. And I've enjoyed a career as an academic vascular surgeon, and one of the reasons I enjoy it so much is the opportunity to interact with students and trainees, residents and fellows, and to continue to be renewed by the energy that comes with that. So folks like you guys provide so much great energy into the field. I've also been able to maintain a creative interest throughout my career. I've been lucky enough to have NIH funding for a research lab throughout my career and to run some clinical trials and to participate in a whole range of research, but also to help train other young vascular surgeons, which is just incredibly rewarding. So you know, can have all those options in an academic career, but of course there's many other alternative pathways you can take when you get your training in vascular surgery. So I guess from my perspective, this is a very exciting thing for us to be doing. And I can tell you just a couple of things that might tell you if you're in the right place. So if you think you might enjoy having long-term relationships with patients, getting to decide when, how, and what kind of treatment to give them, and getting to see how well that does for them over the course of many years, you're in the right place. If you enjoy collaborating with other specialties, being needed to help other surgeons, working together to solve complex patient problems, then you're in the right place. If you're someone who likes technical challenges and creativity, sometimes you may have to start out with plan A, but you might end up with plan C or D. If you can think on your feet and you like to think fast and be reactive, then you're in the right place. If you like science and technology in a field that's transitioning, recognizing that I myself today, probably half of what I do, I learned after I finished. So not static at all, continuous learning, very dynamic, then you're in the right place. On the other hand, if you're looking for something that's very static, can be put in a small box, and is very predictable every day, you might not be in the right place. So I would just say that this career, the most important thing about it really is the first thing I said, which is the give back that you get from the patients and their long-term relationships is very unique in surgery, and the ability to solve complex problems on a daily basis is really quite rewarding. So as the president of the Western Vascular Society, I'm excited that we're reaching out to students. I hope that some of you will obviously continue your interest, maybe come to our meeting or participate in different things that we have to offer for you as a society. And I'm always available for any student who wants to reach out by email or to contact me. And I'm going to pass it back to Leanne now.
All right, great. Thanks for that introduction. So next, we're going to have Dr. Misty Humphries, who has been leading this committee on starting the vascular surgery interest group within the Western Vascular Society. This has been really an exciting project for us, and we're really just it's ecstatic about having all of the medical students join us and learn and get excited about vascular surgery and what we're doing here on the West Coast. She's the current program director for the vascular surgery integrated residency at UC Davis. And like I said before, she's the VSIG chair for the Western Vascular Society. So I'm going to let her take it over and kind of just give a little intro about what our committee is about and where we're headed and what she has envisioned in the future for us. So Dr. Humphries.
Thank you. It's hard to follow that kind of inspirational talk from Dr. Conte, and it is interesting, as you said, like half of what you do, you didn't learn in training. I'm about to do two, not right this second, but in the next couple of weeks, do 2 open aortic cases. And I feel like I'm doing things that nobody does anymore. It's like I'm the oldest person in my group, but I'm not. But when I think about what the future of vascular surgery looks like, the integrated residency has changed the playing field for so many of us. We have young people that are coming out of medical school and going straight into a vascular surgery residency, and how to train them and what it looks like, and making sure that we have some of the brightest and the best and the brightest young people in our field is really important. As Dr. Conte mentioned about what vascular surgery is and isn't, I think it's the things that really resonated with me is it's this incredible place where you get to play with all of the cool toys, but you also get to build these really lasting bonds with your patients. And where I am at in Northern California, there's this big focus on primary care. And in some ways, I am the primary care doctor of the blood vessels, is what I think of, and of the patients. And we build these long-term relationships. When we're looking at where the future of vascular surgery is going in terms of medical education, I think that we see young people coming out and being really well trained to do very complex procedures. Our committee has been tasked with helping people in medical school and trainees understand what vascular surgery is, why it is an exceptional field, and why it offers so much more than some of the other fields. A lot of people will tell you that when you're a hammer, the world is a nail. And I have always felt that we have so many more different things in our toolkits as vascular surgeons. We can do open work, we can do endovascular work, and that's really something that's unique to this. So you become this kind of important person in the field of vascular surgery. This committee itself has developed this particular webinar where we're going to talk to young trainees about how to go into the field of vascular surgery. In a few months, we're going to work with program directors to try and help programs set up vascular surgery interest groups in their institution, which any student that's here could help initiate at their own institution. If you don't have a vascular surgery interest group, our committee could even help you arrange that. The vascular surgery interest group at some of our organizations do things like suturing workshops, endovascular interventions where they're on a simulator, and just kind of all of the neat stuff that we do that you could expect in residency. And our committee is the Western Vascular Society is going to have a fall meeting. Our annual meeting is in Jackson Hole. We'll have several scholarships that we're going to be giving out for people to come to the meeting itself. We'll have a program there that's about an hour and a half, and also a mentor partnership for students. And then you can get exposed to even more of it. So if you are here this evening, you'll also get later emails about applying for the scholarship so that you can come and visit us and hang out with us a little bit in Jackson Hole. So thank you, Dr. O'Banion, for leading this, and I'll give it back to you.
Great. All right, great. Thank you, Dr. Humphries. All right, so now we're going to hopefully, after those awesome introductions, get into kind of the nitty gritty of this. So first we have Dr. Niten Singh as our first panelist. And my little intro slide went away, but he is currently the program director at the University of Washington, and a integral part to their residency. And so hopefully he, as a program director, will give us a little bit of insight. I know we already have a question. Dr. Singh, I don't know if you can see it, but I think that maybe you'll be able to address this during your little section with step 1 going to pass fail. What are some of the changes you'll predict in the admission process for vascular surgery residencies? So I think he has some slides prepared for us, and he's going to give us a little insight on to why he went into vascular surgery and some of his perspective on how to approach going into vascular.
Well, great. I'm going to share my screen with the group. And should be on. Hopefully you guys can see that. Well, thanks. Actually, Dr. Conte and Dr. Humphries have already given my talk, so I could make it really quick, but to echo what they're saying. But I think we all have our own reasons for going into vascular surgery, and for the students on the call, I hope that you guys, will get some perspective from the talks tonight and the discussion that's to follow. Okay, no disclosures. So why vascular surgery? You've already heard it. I think, vascular surgery is a great group of individuals. If you just heard our banter beforehand, people are just having fun. It's a close-knit group. It's small. It's not like we have 21,000 vascular surgeons out there. We have about 3,500 people know each other. They get along and we have a common cause. We do fantastic procedures. We have excellent patients. We have cutting-edge innovations, as Dr. Conte mentioned. And, I think that we stayed on top of our specialty and are able to treat it with minimally invasive techniques, as well as refining our large open procedures. You can still get the good old-fashioned ruptured aneurysm and be able to treat that, because you're going to be trained to do that. And you get to remove old minimally invasive devices and fix a patient, because that's in your skill set as well. But you get to operate in different cavities. You get to do bicavitary operations, thoracoabdominal aneurysm, again, which is like, again, what Dr. Conte said, being able to operate in anywhere on the body. But at the same time, you get to do some great innovative stuff. This is my partner, Ben Starnes, who's got an IDE, investigational device exemption on physician modified endografts. And you can treat complex aortic pathology via 2 femoral punctures and modifying a graft to do that. And you don't have to send something away. If a patient comes to you with an irradiated neck and a symptomatic carotid, you're trained to do carotid stenting and treat this patient. So I think that the skill set is there. You get to remove big chunks of calcium from people's arteries and allow them to heal wounds in their legs. And it's all of those things that I think refresh you every day as to why people go into vascular. But in this group, I bet you on this call, most medical students have already gravitated to the following areas. In your class, you're going to have people that just say, I want to be in a clinic, I want to be a medicine type specialty. You have those that are procedurally based, that want to do surgery or some kind of interventional type procedures. You get those that love kids, they want to be a pediatrician. That's always in the class. Then you get the non-clinical folks. People say they don't want to see patients, and those are your radiologists and pathologists in your group. And I think overall, throughout your medical school experience, you get to identify people that you relate to and enjoy being around. And I think that's what happens during your clerkship time as well. So my path, the question was, how did I get to this place? I originally wanted to be an orthopedic surgeon. I grew up playing sports. I thought that was what I wanted to do. I participated in the surgery and orthopedic interest groups in medical school. But I did my 3rd year ortho clerkship and I didn't enjoy it. It was, I was doing a total joint team. So I was, doing total hip arthroplasties in a spacesuit. It just wasn't what I thought of as being an orthopedic surgeon. I got to rotate on trauma surgery and we had a gunshot wound to the abdomen and we saved a life. And I was sold. I thought that this was the way I wanted to lead my life, doing trauma surgery. So I did a sub-I, and many of you guys do sub-Is obviously as a 4th year. I did a sub-I in trauma and vascular surgery, but during the trauma sub-I, I think I spent more time in the CAT scanner than I did in the OR. But when I rotated on vascular surgery, that's where I was able to meet Dr. Steve Murray, a prominent member of the Western Vascular Surgery Society. And he was doing open AAA repairs, bypasses to prevent amputation, carotid endarterectomies. And he's doing all the cool stuff in trauma, which were vascular injuries. And he became a great mentor. And as a medical student, he was a guy who just finished his training at UCSF and was, in San Antonio as a surgeon. He's still cool. I mean, if you look at Steve, I mean, he still is swimming races and has had a very successful practice in Spokane. And I always thank him for inspiring me to go into vascular surgery as a medical student. But I think, as a vascular surgeon, you have comprehensive care of vascular disease. There is no cardiology equivalent to cardiac surgery. We take care of the patient from start to finish. We see them as an outpatient. We manage their medications. It's the ultimate in precision. Every bite matters. Adequate's not good enough. It's got to be perfect or you're going to be back, and it's immediate gratification or sorrow. And, if you do a bypass on somebody and you don't have a palpable pulse at the end, you got to fix it. It's not going to get better in the recovery room. So it's one of those things where you have to be on your game. And I think many people are drawn to that. But again, harking back to the great people and the great mentors, and if you look at this, it's very West Coast kind of heavy. And most of these people are Western Vascular Society or Western Vascular Society members. These have been my mentors. Peter Schneider was a mentor of mine when I was a resident, continues to be a mentor to this day. David Deaton, who was with Dr. Wes Moore at UCLA, were the first people to implant endovascular grafts to repair aneurysms. Dr. Tony Sadawi was my program director when I was a fellow, and still sends me wise words that I listen to very religiously. And my current partner and division chief, Ben Starnes, who is immediate past president, continues to be a great mentor. But these folks now are our colleagues and friends. It's one of those things where, again, we're not a huge specialty, so you get a lot of close people that you can pick up the phone and call. Again, why do I like my job? I think we have the best patients in any specialty. Vascular surgery is generally a fair disease process. Many of our patients have led a hard life. They smoke, they haven't taken care of their diabetes, but they come to you hat in hand saying, can you save me from having this aneurysm rupture? Can you save my leg? Can you prevent me from having a stroke? And they're older patients and they all have stories. And the nice thing about it, I think, as Dr. Conte had mentioned earlier, is that we follow our patients. We get to know them. We get to know their families. If you're in another surgical specialty, if you're a general surgeon following a hernia repair for 2 or 3 years, something went wrong. But that's just the norm for us. In vascular surgery, we see people and we follow them forever. And I think the other unique part I like about the job is that it gives you a unique skill set to handle things. When I was in the military and being deployed and having to deal with vascular trauma, I could tell you that the trauma surgeons love having vascular surgery around, because the one thing trauma surgeons fear is exsanguination. And as vascular surgeons, we're drawn to blood vessels and fixing it. And I think it gives you a unique perspective to handle this, and you look forward to these kinds of cases. Professionally, I think it's your partners and what makes things great. And in vascular surgery, not just at our institution, but team is not a concept, it's reality. We were talking, you heard some of the banter, but there's a WhatsApp out there where I could put a question out to anybody and around the world, and vascular surgeons will be there to help each other. And it's a fantastic thing to see. But as partners, we look out for each other. I've got great partners in Dr. Alina Karoga, Nam Tran, and Ben Starnes, but I got 15 partners in my division who have various specialties that I can call and ask for help, and everyone's there to do it. I think the other thing that was mentioned was academics. I'm a program director, and I think the thing that inspires me is having fantastic fellows and residents and being able to train this group of people. And you have to bring your A game when you're dealing with this group, because they're inquisitive, they're smart, and they're excellent. And generally, when you're working on research projects, it's fun to watch them. When you're watching them grow, particularly an integrated resident go from about a 3 to a mid 4 level, and watch them just get vascular surgery, it's exciting. So as far as training in vascular surgery, there's been an obvious shift in the training paradigm. So what are your options that were mentioned earlier, right? So 15 years ago, we adopted the primary certificate, and we have a traditional pathway, which is 5+ years of general surgery, 2 years of vascular surgery. I did 6 years of general surgery and 2 of vascular surgery. So it took me 8 years to become a vascular surgeon. The integrated pathway is created to allow people to become a vascular surgeon in as quickly as 5 years. Many programs have research time built in as well, but you can become a vascular surgeon in 5 years. So there's now 2 training paradigms, and from the poll, it looked like the majority of people were interested in the integrated pathway. So if you're interested in vascular surgery, I'd say, number one, identify a mentor. And the Western Vascular, and hopefully this committee led by Dr. Humphries, we can help you with that. Join or create a VSIG, and again, we can try to help you with that as well. I think that those things can be done, and it can be very successful. Attend local and regional conferences, and I'm tooting the horn for the Western Vascular again, but we have scholarships offered for the medical students, and it's a good opportunity to meet vascular surgeons and trainees from multiple institutions on the West Coast. Now, what's the advice I would give? If you know you want to proceed with vascular surgery and integrated residency, I'd say do a sub-I at your institution, if possible, with the pandemic restrictions. See if you can do an away sub-I so you can experience other institutions and ask questions about the specialty, especially from senior trainees. Try to avoid asking the PGY 1s or 2s, because they're getting kind of beaten down a little bit. They may not give you the best perspective, but ask a chief resident or a fellow, and they'll probably be able to be a little more perspective, give you a different perspective on vascular surgery. And also participate in research projects if you get the opportunity. If you're not 100% certain you want to be a vascular surgeon, but you want to be a surgeon, then do what most of the people on this call besides Dr. Rollo did. It's apply for general surgery, rotate on vascular surgery, explore other areas of surgery, and consider vascular surgery. And if so, apply for the fellowship, because it's still a great way to go. The one thing that I'd say is that if you're interested in vascular surgery, I think you guys have made one of the greatest decisions of your life. I think you look back on it, you want to find a career in which you can be passionate about and enjoy it, because the majority of times, no matter what you're doing, you're going to be spending most of the time at work, and you should enjoy what you're doing. And I think vascular surgery is that specialty that allows that. Anyway, thank you. I will stop sharing now. Try to get it back to you, Dr. O'Banion, if I can. All right, hold on.
All right, and there we go. All right. Well, thank you so much, Dr. Singh. I mean, I'm a vascular surgeon and I'm inspired after that. Make me want to go do it all over again, almost, not quite. Next we have Dr. Sharon Kiang. She is the chief of the Division of Vascular Surgery at Loma Linda VA. And she is the chair of the IRB committee, as well as the director of research. She did a 5+2 general track plus fellowship. So she's going to be here to kind of give us a little bit of a perspective on that and why she chose her path, as well as a little bit of a perspective on what it's like to be heavily involved in research and IRB and academics. And so hopefully you guys will learn a lot from her, and we're excited to have her on board today. So I'm going to turn it over to her. I think she's got some slides embedded in here. So here we go. Thanks for joining us.
Thank you so much to everyone for letting me give my little story. And I want to just say it's so hard to follow Dr. Singh. He's kind of covered everything and he's got these super cool slides. So just bear with me. I actually just have cartoons. So I, wanted to reiterate that, a lot of us have chosen different paths and different ways of how we, have gotten into vascular surgery, and 5+2 is the classic way. But as Dr. Singh had mentioned in his talk, and for me in this case, a lot of us had a little bit more years than that. For me, it was 7+2. I did 7 years of general surgery, and where I was, there was a mandatory 2 years of research. And those research ended up being critical reasons why I actually chose vascular surgery. And then after that, of course, 2 years of fellowship, and here I am. Next slide, please. So to start off, we kind of have to take a little trip back in time. And a lot of it is, I'm just going to give you a quick blurb about my background. I didn't even know I was going to go into medicine. I started off as a musician. I was a classically trained cellist. I started off as a conservatory. I thought that was what my life was going to be. Lo and behold, massive switch, and end up going into medicine. When I went into medical school, it was a very different time. I don't want to make myself sound like I trained in the Jurassic period, but medical education has changed a lot in the last 10, 15 years. But when I came through, it was a different education paradigm. I had a very traditional medical education, right? Class was 8 to 5. Anatomy and embryology were Saturday mornings, right? There was no pass fail. It was all A+, A minus, right? A very standard education. And then when I went into surgical training, it was a slightly different philosophy too. I went to a program on the East Coast where they felt very strongly that you had to put in your time, and you basically time equal to success and time equal to credibility. And a lot of that has changed when we have moved away from traditional training, traditional education, and seeing how all those things can be streamlined, right? Just because I train longer doesn't mean that necessarily I train more efficient. And so at that point, it wasn't like I had a choice. There was no such thing as, anything shorter than the traditional program. It was 5+2 or 7+2 or bust, right? That was the only way moving forward. And during my time, that was the only options that we understood. And so that's why I ended up in the 5+2 or the traditional program. But, if I had to be truly honest with myself, I needed that time too, because I honestly didn't know. I've listed all the things down there that I thought I was going to do. I thought I was going to switch out of general surgery to become ENT, then realized the whole sputum thing I couldn't deal with. Then I thought I was going to be a colorectal surgeon, and I decided that fluid of choice was not going to work for me. My 2 years of research, I went into oncology research. It was a surgical oncology research fellowship, and it was lots of time in the lab. My background is actually in basic science. I'm talking basic science, right? Knockout clones, siRNA, all that good stuff. And so I was going to come out and cure cancer, and I was going to do surgical oncology. And then that didn't really pan out when I came back out. Then I thought, okay, well, I'll do thoracic surgery. And really, honestly, that chest stuff, wasn't going to go there. And then it wasn't until I, finished my research year that I really saw the light, because when I was doing my research, all the other residents were in mandatory didactic stuff, right? All the mandatory didactic conferences, and they needed the research resident to help start the vascular cases in the morning. So lo and behold, every Tuesday morning, here I was with this awesome old school vascular surgeon. His name is Dr. Gusberg. And that was all the open aortas. Back then it was all open aortas, open aorta bifems, right? We had like 3 or 4 of those a week. All the carotids. And I just lost it, because I ended up in a case that I never thought I would like. I ended up understanding pathology and anatomy that I thought was way too scary for me to understand, and I just loved it. And so I thank those research years because I was forced to cover those early cases, and that's how I got my hands in to those big cases that I normally wouldn't even have a chance to do so. Next slide, please. So Dr. O'Banion and Dr. Humphries and Dr. Conte asked me to talk about what the pros were. And, you know, a lot of surgical training has changed, but when I was there, it was still the full breadth of what we considered general surgery at that time. And some of the things that something like cardiac surgery, plastics aren't always part of the curriculum anymore. ENT was a huge part, urology was a huge part. And I really felt like I had a full ground understanding of, you know, every aspect of the human body. And so when I finally chose vascular surgery, I felt like I fully consented to it because I actually was fully immersed and fully engaged in all the other subspecialties. And I knew when I chose vascular surgery, I knew I also didn't want to do anything else. And I think that's something that may be lost currently because we're so time pressured into constraining within hours and constraining within, you know, expectations of certain metrics that we don't always allow our students to be fully engaged and immersed into other fields. And I think that's really important. And for me, at least, that was really important. And I appreciated the time that I had to do that. And so when I found vascular, I really found it and really knew that that's what I wanted to do. And some of the things that I really appreciated during my time in my relatively long residency was that, you know, I established a lot of mentorships and collaborators and friendships, etc., relationships that have lasted to this day. And there's something that I cannot explain or even replicate unless you kind of do time with a full group of people. So I'm talking about at that point attendings, fellows, you know, other residents that were in my class or around my class, because that experience bonds you and you end up in these great relationships that have now grown my career. They have become my collaborators. They've been my supporters. They've been people that, you know, have written my letters of recommendation when I ask for promotions. They have been the ones who sponsor me to societies or other types of meetings. And, you know, they've really shaped the way I have developed a multifaceted academic career. And I'm not saying you have to do a traditional pathway in order to have that experience. But for me, it was through that long length of time with all the people that I had to work with at that time. And now I realize I had the privilege to work with that really impacted the way I have shaped my academic career moving forward. Next slide. And cons. I actually thought about this slide really hard because throughout the years, I have complained a lot about what I had residency. We've all had those crazy stories back then of whatever, 100 kabillion hours a week, right? We've all, you know, drank some Jevity along the way to get through the transplant rotation. We all, you know, have eaten the graham cracker and peanut butter at the nurse's station. And I've, you know, said a lot of things, but I don't regret any of it. And I think one of the cons I would bring up is it is an extremely long journey. And for me, it was 7 + 2, that's 9 years. And that was a huge chunk of my time. And I've had to, for me at least, because of the way I trained and what I had wanted, I had delayed my family. I found my husband during residency. So, you know, he was very, very supportive. But you have to find someone that's also on board with that time and also the ambition and the goals that you have. And so for me, I don't regret it. And for me, honestly, it was the path that I knew I had to do and I knew I had to get through to get to where I am. But when I look at that now and I look at those numbers now, you know, it is a very long time. The rest of what I can say is vascular has been the most amazing field. Vascular is a relatively young subspecialty compared to the other ones. For example, surgical oncology, general surgery, you know, trauma surgery. It's relatively young. And vascular grows at a pace that I think is unreplicated in other fields because we're so technology married. And as technology develops and as, you know, industry develops as well, our field moves along too. So you know, 1 year and one generation of vascular surgeons, things can be done very differently. Things can be evaluated differently. For example, right now in my lab, I'm working a lot on disease modeling using artificial intelligence, right? Looking at disease predictors and trying to impact that way into patient care, and in my case, veteran care. And so none of that could have been done even years ago because we didn't have the AI cores that were built and the large memory machines that could, input all the metrics that I'm looking at. So things develop really quickly. And sometimes it's not just like the next way that we bypass this. So vascular touches every part of, what you may want to do. If you looked back on my intro slide, I'm also the chair of the IRB committee, and that is a part of a career that came up unexpectedly. I didn't think I would have that opportunity, and being a vascular surgeon didn't hold me back from exploring that. It didn't limit my ability to go into other types of leadership. So, if I could say anything to the group is that vascular surgery is innovative, it grows, it's constantly changing. But at the same time, you can parlay all the skills and all the knowledge and the leadership and the growth you have in vascular into developing other parts of your career as well. And I think that's all I have. Everything else, I think Dr. Singh covered. Oh, final question. I get asked this all the time. Would I do it again? In a heartbeat. Now that I know where things have been, if you ask me that, I would absolutely do it again. No question at all.
Great. Thank you so much, Dr. Kiang. That was excellent. I think that you'd be hard pressed to find very many vascular surgeons that wouldn't say they would do it all over again. I think we're a pretty fun group. We like what we do. So our final panelist is Dr. John Rollo. He is assistant professor of surgery with Dr. Singh at the University of Washington. And he's going to give us his perspective. He's the unicorn of our group in that he actually did one of the 0-5 vascular residencies and is now, I believe, one of the first Western vascular members that has completed an 0-5 residency. So we're excited to have him here today and give us his perspective on why he chose his pathway and why he chose vascular. So welcome. Thanks for joining us.
Great, thank you for having me. It's my pleasure. I don't have any slides today. I'm gonna try and make this brief and hopefully get some time for some questions for everyone. A little bit about me. Like was mentioned before, I actually completed an 0-5 residency, which I'm now an attending here at University of Washington. I am the site director for Northwest Hospital, which is owned and affiliated by University of Washington. I also am the assistant program director with Dr. Singh at our site. So I have 2 trainees with me right now, an R4 and an R2. I love my job and I have no regrets whatsoever. So my story is, I actually did not apply to integrated vascular residency. I actually applied through the general surgery pathway. And when I got to UCLA as a general surgeon, I rotated on a rotation where the brand new first-year fellow was Sharon Kiang. And I distinctly recall going up to the resident workroom and her furiously asking me, how do I order this CT scan? And so that was my introduction to vascular surgery. I had no idea that I wanted to be a vascular surgeon. When I was in medical school, I dabbled in a couple other orthopedics and a couple other specialties, and I settled on general surgery because I thought that they had the most, commanding, presence in the operating room. The trauma was very enticing. They just seemed to be masters of surgery. And honestly, there wasn't much knowledge about the integrated vascular programs at the time. This is back in 2011 when I was applying. There was very little integrated vascular residents. I think there might have been not even a single graduate at that point of any O15 program. So it really wasn't even on my radar. So when I got there, you know, I didn't know that I loved vascular, but after my first rotation as an intern, I definitely piqued my interest. And I had the good fortune of kind of landing in this position in the integrated vascular residency as the very first resident at UCLA did not finish. She ended up leaving the specialty in the beginning of her second year. And so I took that job and I took that role and I ended up switching. And then I became the first integrated resident at UCLA. So it was a brand new process at the time. There was no, you know, the program was being built. There was nobody ahead of me. I had no, you know, senior residents to call on. It was just me kind of making it up as I go and paving the way. And it was really, it was an amazing experience for me. You know, there was a lot of trepidation in starting a vascular residency for me. The general surgery pathway was very well known, was very established. I knew exactly what to expect. And in the integrated surgery pathway, it was hard to know what to expect. There wasn't any, I didn't have any predecessors. And I didn't know how they would do when they graduated. I didn't know how they would, if they would get good jobs, if people would take them seriously, if there was going to be some kind of two-tiered, you know, system when you're graduating, if the O15 residents would be, their skills would be questioned. So there was a lot of uncertainty when I joined, and fortunately all that uncertainty is gone now. When I finished my training after 5 years, I was heavily recruited. I had no trouble finding a job, and in my first 3 years of practice have been extremely successful. I do a huge variety of operations all over the body. Just to give you a sense of it, I have a very, you know, broad spectrum practice at a very busy community type hospital within the UW system. And in the last 10 days, I did a first rib resection, an AV fistula, vein ablations, transcarotid artery stent, an EVAR, a below knee amputation, multiple complex lower extremity revascularizations with advanced endovascular techniques, an emergent carotid artery repair after a neurosurgeon bovied into the carotid artery, and they called me in to go fix it as the patient was bleeding to death. And then I did some wound care. So it's a pretty wide variety of what I do on a daily basis, and I love every minute of it. Just to kind of briefly, and a lot of, you know, this has already been discussed, but to briefly go over some pros and cons. You know, the cons of doing the residency program are primarily that you have to decide basically right now, depending on what year you're in, that you want to do vascular surgery. And that's a pretty big commitment to make as a med student. You don't really get all that time to explore other specialties. You really have to kind of focus in on it. In residency, you have a very compressed learning experience. You have to learn first how to be a doctor, and then you have to learn how to be a surgeon, and then you have to learn how to be a vascular surgeon, all within 5 years. That's a lot to ask. And it makes every day at your job as a resident extremely important. You have to soak in all of those learning experiences because you just don't have that luxury of time to really dilly-dally in residency. And you definitely have more limited open abdominal experience. But the pros of vascular integrated residency to me are far outweigh the cons. Obviously the time, you get more time as an expert. You know, when I was a third year, I took call and, you know, I was the vascular surgeon resident that was, you know, had the most expertise in the building at the time. And that time as an expert, I think, is really valuable, focusing on vascular surgery. You get integrated into this very small community very early in your experience as a resident. I was presenting, you know, at the Western Vascular Surgery as a resident in my second year. I presented in my third year. It's a very it's a very early introduction to a very small community. And so people get to know you by the time you graduate. You know, I was having beers with Dr. Singh in my 4th year at the Western. I remember it like it was yesterday, and that helps you in the job hunt. Every rotation matters. Every rotation you're on as a vascular surgery integrated resident is crucially important. There's no, time, doing colonoscopies. There's no time, taking out gallbladders. Every rotation matters in an enormous amount. And that really motivates you every day. You get up going to work knowing that I have to really focus today, or else, after 5 years, that's it. That's all I get. That's all the training you get. And you get a lot of extensive endovascular experience, which I use every day. So overall, I think, I'm very grateful for this opportunity to be a vascular surgeon. It has been a fantastic career choice, and I really honor my time every day that I get to go into work, and I actually get paid for it now. It's pretty amazing. You will one day soon. So good luck.
All right, before you run away, there's actually a question that you're probably the most appropriate to answer, and I think you kind of did already. Do you feel like you received more endovascular or open training during your ON5 experience? And I think that's probably like every medical student's question is. They want to know if they're going to get the open training during those 5 years necessary to be a great vascular surgeon.
Yeah, I think that's a really good question. And I will, the way that I like to answer that is this. Most general surgeons, most, anybody that operates in the abdomen, most other surgeons in general are, their whole mission when they're doing an operation, when they're conducting an operation, is to avoid blood vessels. It's to get away from things that are going to cause bleeding and exsanguinate the patient. Whereas vascular surgeons, our mission is to find the blood vessels, expose them, and then operate on them. It's a very different perspective. And I'll tell you that I learned a lot more with that perspective on my vascular rotations than I ever did in general surgery. The only thing, what I learned in general surgery was to avoid blood vessels. So I will say that, of course, I don't have the extensive abdominal experience that Sharon has. Dr. Kiang obviously spent many more years getting into and out of the abdomen, mobilizing bowel, et cetera. There's nothing that will replace that. But I will say that you will be well-trained and able to do that by the time you're done, but you have to focus on it. You have to really relish those experiences and take advantage of that time. You can't just be sitting back, half paying attention, thinking about when you're gonna take a nap next, because then you will miss out.
I'd like to also kind of say a little something to what John just said, Dr. Rollo just said about, you're not going to be doing lap choles and things like that. I actually think that that's something that when you are looking at programs, you need to look at what their general surgery core rotations are, or what will be your core rotations. Places that are very specific about their training have developed core rotations in areas where they think you're going to get the most bang for your buck as a vascular surgeon. So for a while, when we first started our program, our core surgery rotations were just randomly assigned by the general surgery program. But after a few years, we started being very specific about the core surgery rotations that our vascular residents would do, so that they would do things such as surgical oncology, where they'll get experience with how to move the bowel in these oncologic resections, they're looking for vessels staying around for that. So I thought it was really, very important what you said. You don't want to be on a rotation where you're doing, things that you might not, or that don't translate over to vascular very well. And most programs are being very specific about how they're choosing their general surgery rotations, or their core rotations as they're called.
All right, thanks guys. So I'm going to kind of go through some of the questions and hopefully we'll get to everyone. I think that another hot topic for everyone, and hopefully the program directors on the panel can answer this, is what do you think about the upcoming application cycles? And do you see interviews happening virtual, in person, a hybrid? I'm going to throw it out to whoever wants to take that one. What do you see coming in the next couple of years?
I could start. I think it's going to be virtual for sure this year. And it's going to be institution specific. Many institutions have already said they're going virtual. But I think overall the AAMC wants everyone to go virtual, particularly for the medical school interviews at many places. And so generally most institutions follow suit at the School of Medicine. And so I think that we'll be obviously doing virtual. I think virtual is good and bad. I do miss the interactions. I think it's great for somebody to come to see your institution. But the other thing about virtual interviews that has the benefit is that it's less costly for the interviewees. You're not traveling all to 20 places and having to spend a lot of money. But I think that it's going to be virtual this upcoming cycle.
Right, great. We have another question. What can a medical student do on a vascular surgery sub-I to stand out as a strong applicant to the specialty that may be unique compared to other specialties / being a strong medical student in general? I don't know, Dr. Kiang, you want to tackle that one?
Sorry, I had to unmute myself. I think, what we look for in a candidate is very much in line with what, let's say, a general surgery program looks forward, right? And some of those things are, a strong clinical presence and, good research. I think it's important that in anybody who wants to stand out, no matter what you're applying for, that you demonstrate that you have a lot of focus, you have a lot of passion, get super involved, right? And some of that may be doing stuff on your own time. A lot of research and a lot of the extra stuff outside of rotations is done on your own time. So, I think it's important that, if you choose to go all out, that it's 100% in. There's not like just a little bit in, and just go and pursue any opportunity that you have. Approach everybody, right? Just don't pick that one attending that you think you want to work with. Approach everybody, make sure they all get to know you, and make sure you're involved, get yourself involved with every one of them doing something.
Right, awesome. And we've got some great questions coming in. I don't know if is Dr. Conte still with us, but as someone who has both a fellowship and an integrated residency, what do you feel are some of the pros and cons about a program where that exists? And, what would you say to the resident who's not really sure whether they should apply to both general surgery and the integrated residency? They know they want to do vascular and they want their best shot at it. Should they apply to both? Should they just go for the integrated program? Maybe you can give us some advice there.
Tough question. I think that, Sharon sort of hit a few of these points, but I think if you are attracted to surgery, but you're really, not really sure that vascular is it for you, then that might be one reason to do the general surgery path. On the other hand, if you, have been doing work with vascular surgeons, have already have some experiences, with vascular surgery, have been doing research in the area, and you're pretty much committed to that's the field that you're interested in, then I think, the question comes down to what kind of program do you want? And I'm saying that because programs do have differences, including opportunities for research or not. So that may be another consideration for you. Do you think that you want to have an opportunity to do research or not? And will that be different for you if you do one path versus the other? At the end of the day, there's, for us, we have both pathways available because they attract different people. And so we're committed to continuing to give our residents at UCSF exposure to vascular surgery so that they become interested in our fellowship, and our students exposure to vascular surgery so that they become interested in our integrated residency. And it's too early for me to tell if the phenotypes at the end are going to be any different. But I think you have to know where you stand going in.
I have a little question and comment too for Mike and Niten and for the same kind of thing here. But I think sometimes people are worried also about applying to general surgery and vascular at the same place. I actually don't see who applies for general surgery And I would think now that we're doing more virtual interviews, there's this option to apply to both programs at the same place if you feel that there may be an issue that wasn't really there. If you had to come out twice for the general surgery and then you came out for vascular, that was something that was maybe not as kind of under the radar. But I think that, what are your thoughts on that? Because I just kind of thought of that as I was reading one of these questions.
You know, I think that's an interesting point, Dr. Humphries. I don't know. You know, I think there's anxiety among the applicants, and I believe that if you're a strong applicant, you've done well in medical school. Obviously, step one's not going to count. We've done well in step two. You got good letters of recommendation, and you want to do vascular, and that's what you want to do. Then I think you apply to vascular, and that's what you should be doing. I'm not, you know, the whole apply to both. That's a question that comes up a lot, and my response generally is I'm on the other side, right? So I'm not on that side. So it's always interesting when you tell them that. I talk to some of our more recent trainees, because I think the residents have a really good perspective on that, particularly the ones that have just gone through some of the cycles and how they approached it, because they could be, I think, more objective and a little, you know, let them know what their experience is with that.
Awesome. There was a question that came in via email, which I think is kind of always a fun question. What is the extent of trauma work that vascular surgeons can engage in? Is it possible to do a fellowship in qualified in trauma surgery after an integrated vascular surgery residency? How much more disadvantaged would the integrated pathway graduate be if they're interested in working in this sphere as well? John, why don't you tackle this one? Because I know you've got an interest in trauma, and I can say firsthand, there's a ton of room for trauma and vascular. So there's a lot of us that enjoy it. So what are your thoughts?
Yeah, I would agree. I think if you're interested in trauma, then there's no better specialty than vascular surgery. I always thought that the coolest part of trauma was fixing blood vessels, and the general surgery experience in trauma, at least at our institution, also at UCLA where I trained, was principally that the general surgeons controlled bleeding and the vascular surgeons fixed it. And I enjoy being the one that fixes it. So, you know, there's a trauma and vascular surgery is very fascinating. There's endo options, there's open surgery. It's a lot of variety. So I think that, you know, that's if you're interested, it's a great specialty to do trauma. What I would advise you to is try and get to a place that has a heavy trauma experience in general. Harborview is one of those places, but you know, in terms of whether you can do trauma fellowship after 0 and 5, I don't think it's very common at all. And I think that you'll find it's unnecessary, because if you want to be a vascular surgeon at a heavy trauma institute, you'll get plenty of trauma calls for a vascular surgeon. You won't be missing out.
Great answer. So I'm gonna we're kind of coming up upon 7 o'clock. So I'm gonna give one final question, and then if we didn't get to your question, Heather can share the questions with the group, and we can certainly get your answer via email or chat. So the last question is gonna go. I'm gonna let everybody on the panel answer. My question for you is, if you were a medical student applying to residency today, what would you choose? Would you do vascular integrated residency or general surgery plus fellowship? So I'll just start at the top of the screen and let Dr. Kiang answer first.
So you're asking if I would go traditional or 0 and 5?
That's right.
I actually probably would still pick traditional. It's a personality defect, right? I have this obsessive need to know everything and be involved in everything. And Misty's laughing at me right now, and I think Dr. Conte may never look at me the same again. But honestly, as a vascular surgeon, for me, I, worry a lot. I'm a perfectionist, and vascular pathology is not exclusive to one body part, right? It's everywhere. So you have to know what you're doing. And I would say the classic example was I had a Roux-en-Y gastric bypass patient who ended up in an MVC with a posterior hepatic liver injury into the cava, right? And I don't think I would have understood how to even get in there and help fix it if I didn't have some form of general surgery under my belt, because those patients exist. And vascular is just not exclusive. It's not exclusive to any form of patient. It's not exclusive to body part. So for me, I think I would have done the traditional again, because that's just the obsessive kind of person I am. That's just my pathology, not everyone's pathology.
All right, Dr. Rollo, you're up next.
Yeah, I would definitely do the integrated program again. Like I said, I started off in general surgery. I thought I was going to be a general surgeon, and I love and appreciate everything that is in general surgery. But for me, even knowing everything I know now, going back, I would 100% do the O and 5 again. I feel very well trained, and I feel like my practice is exactly what I want it to be right now.
All right, Dr. Humphries, you're next.
Dr. King, I'm only laughing because I agree with you, but I think that the reason that many of us here say we would do the traditional pathway is that's what we did. And Dr. Rollo just said, well, no, he'd do it the same way, and he's doing multiple things. In today's environment, it's so collaborative and you work with other specialists so much that if you are a team and you're a trauma surgeon, you have a trauma surgeon there with a vascular surgeon, then it all works out. So I think if you want to expedite the pathway and you want to really kind of move forward, because you can do a critical care fellowship, or you could do a cardiothoracic fellowship or something else afterwards to get a little bit more expertise. I think going straight through the integrated pathway is a very good way to become a well qualified vascular surgeon.
All right, Dr. Singh.
I mean, I did the traditional pathway, but I would choose vascular surgery because I love vascular surgery. And I don't think, maybe it's sounding old school, but I don't think general surgery is the same as it used to be. I think that, the days of like the general surgeon doing a lot of different things aren't there. And I think most general surgeons often go and do fellowships afterwards because there's not too many just true general surgeons out there anymore. So I would, if I knew, about the integrated pathway at that time, I probably would have chosen the integrated pathway.
All right, and Dr. Conte.
Well, I don't think I'd trade any of my experiences. At the end of the day, I would say you're about to do something for the next 35 plus years. The extra 2 years doesn't mean a lot. It's how you get there. And the experience, I wouldn't trade any of my experiences at the moment.
And I think what you just heard everybody answer is one of my favorite quotes from Dr. Humphries is "you do you." And so I think all of us chose what we chose and we're confident in it and we do it all over again. And I think that's kind of the great thing about vascular is there's multiple ways to get there. But once you get there, you're there for life. And we're a really close and awesome community, and we're excited to have everybody here that joined us, hopefully eventually one day join us permanently. So I think we have one last poll question for the group that Heather's going to throw up here. Maybe. All right. So this is for all the med students out there. In future Western Vascular Society VSIG webinars, are there any other topics you'd like to hear about? Research opportunities, how to apply and be competitive. I know there were some questions I didn't get to that involved that. How can I be involved in Western Vascular? We'd love for everyone to be involved. And then what happens after you graduate, getting a job, or do you want to hear it all? Because we're happy to tell you about it all. So go ahead and lock in your votes. And once we have a good number of people voted, we'll see what everyone said. Great. that gives us a lot of topics for future webinars. We're really excited that everyone joined today. Thank you so much for giving us an hour of your time, listening to this just amazing group of panelists that we had here today. I think we were really fortunate to have so many great mentors and excellent representation across the West Coast. I might be a little biased, but West Coast is the best coast. Last but not least, I want to invite everyone to join us in Jackson Hole this year. Fingers crossed that we're in person. I think we're committed to trying to do everything possible to be in person. I think we're all looking forward to, getting together. We haven't seen each other in a long time. So October 16th through 19th, join us. As we said earlier in the meeting, there will be some emails sent out to you guys to apply for scholarships. And so there'll be lots of opportunities to help you get here to come visit us, and feel free to approach us. I think I can confidently say that every single member on this panel is very easily approachable. You can walk up to any of us, ask us anything. We're always ready to chat. I don't know, Dr. Humphries, do you have any final closing comments?
No, just again, thank you everybody for being here and sharing your experience. If you want more information, Heather can get you connected with any one of us. So if there was some burning question you didn't get answered tonight, Heather can connect you with Dr. Singh or Dr. Rollo or Dr. Kiang or any of us, and you can have that question answered, spend a little bit more time with us, maybe even set up a virtual call. Thank you and have a good night.
All right. Thanks, everybody. And like she said, feel free to contact us. We're always available.